Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, we head to the emergency department to meet trauma surgeon Dr. Chetan Sathya. Dr. Sathya is the director of the Center for Gun Violence Prevention at Northwell Health in New York. Our topic is what we should expect from hospitals and health systems to reduce the rising tide of gun-related injuries. Let's listen. Dr. Chetan Sathya, thanks so much for joining me today to talk about gun violence and what we can expect from the healthcare system to combat it. Now, you are a trauma surgeon.
Yes. Thank you for having me here.
So tell me a little bit about what you do in your job as a trauma surgeon and how it relates to gun violence.
Absolutely. I think many of us in healthcare, no matter what field we are in, have been impacted by gun violence, whether it be to our patients or our communities. And as a trauma surgeon in particular, we have the unfortunate job of having to treat patients with bullet wounds. My journey started in Chicago, where I trained as a pediatric surgeon. And I still remember the first week on the job having to treat a baby with a bullet wound. And as one can imagine, that was pretty horrifying. And unfortunately happened week after week after week, and has continued to this present day. So this is absolutely an issue that I am deeply passionate about as a trauma surgeon, and something that I care very much about.
Now, I can understand certainly trauma surgeons really wanting to do the best possible job to take care of patients who've been shot, but you have gone a step beyond that to trying to prevent them from being shot in the first place. How did you get there in your work as a surgeon?
We often talk about how we should be treating gun violence as a public health issue. And if we're really serious about that, that really encompasses prevention. We, on a personal note, after having treated patients with firearm injuries, all you ask yourself is, how can I prevent this? How can I stop this from happening? How can I prevent myself from having to tell a parent that they lost a loved one to a large and preventable disease? So prevention is really, really critical. And I think my journey started when I got here to Northwell in 2019. Prior to that, I had been doing quite a bit of research in the gun violence space. When I got here to Northwell, our CEO took a big stance on this public health crisis and said that healthcare organizations, health systems, and hospitals really needed to prioritize this as a public health issue. And that reverberated across the entire country, because very few healthcare executives at that level had been willing to prioritize it as a major issue in their communities. That led to the development of our Center for Gun Violence Prevention at Northwell, which is focused on charting a public health approach to this crisis. And one of those main areas, to your point, being prevention.
So you are a surgeon, you are seeing patient after patient suffering from gun injuries, and you're interested in prevention. How does the hospital or health system play a role in keeping people from being shot in the first place?
Well, if you think about the fact that healthcare is a touch point for virtually everybody in the community, we have one of the largest roles to play in that prevention. We've done it with substance use, we've done it with HIV, we've done it with motor vehicle collisions in the past. We have such a critical role to play when it comes to prevention of injury and a public health approach to anything that we consider an epidemic. Specifically at our hospitals right now, we are funded by the National Institutes of Health to universally screen all our patients for firearm injury risk. So we are asking every patient who comes into our hospitals questions about firearm access inside or outside of the household and gun violence risk, two very different things, and then offering an intervention to each depending on if you screen positive.
So, for example, if I were to show up, what would you ask me? And I might be showing up for something else, like I have a rash or something like that.
Definitely. Yeah. This is about normalizing the conversation, about asking about firearm injury, no different than we ask about sugar intake, exercise, or other injury prevention, things like wearing a helmet. So if you came in for, let's say, abdominal pain, At some point in your visit, you would be asked, do you have access to a firearm inside or outside of the household? Again, confidentially. And you would also be asked a series of questions such as, have you had a gun pulled on you in the last 6 months? Have you heard gunshots in your community in the last 6 months? These are actually questions that we know have been validated to predict future gun violence risk that we are now asking at the point of care so that we can intervene.
Okay, so I'm glad I don't have a rash and I have abdominal pain now. Hopefully it's nothing serious. And you asked me those questions, and let's say I say, yes, actually someone did pull a gun on me in the last 6 months. What can that health system do about that? I mean, are you going to call the police and let the police know? I think that would be a natural question people would have.
Yeah, so it's important to know that these questions we're asking as screening questions are done confidentially. This has nothing to do with gun ownership, has nothing to do with gun control. These are simply asking about risk factors. So the same way we deal with other risk factors, we can respond as a health system. So if you screen positive for violence risk, we will offer motivational interviewing at that point of care, which we know can help. Social workers will then be in touch. And you'll also meet credible messengers from the community that can help partner with those patients to break the violence cycle. We call those groups community violence intervention groups. And that really helps to curb gun violence. If you screen positive, Josh, for firearm access, you'll then get gun locks, firearm safety counseling, and firearm safety courses in the community.
Got it. Now, I also understand some of these programs are particularly active for people who have been shot and survive so they don't get shot again. Is that right?
Yep. Particularly a hospital-based violence intervention program, when we focus on the firearm-related homicide piece, has traditionally been used after a patient comes in with a gunshot to help break that violence cycle. We're looking to take this a step further, to screen before the gunshot happens, to hopefully prevent that from ever occurring.
Great. Now, Dr. Sathya, did you learn about this in medical school? Was this part of your approach to the care of the patient with the bullet wound?
Great question. Absolutely not. We all we learned was, how do you treat that bullet wound?
Yeah.
And you're hitting on one of the major points of this universal screening effort, for example. It's to normalize the conversation about firearms. We want to make this part of medical vernacular. It's been an uncomfortable topic. Very few physicians actually screen patients for firearm injury risk. We want to change that.
And this is beyond just trying to get physicians to do it. You're trying to get hospitals and health systems to normalize it. Do most hospitals think this is their job, or do they think this is something that happens to people outside the hospital?
I think we're generating increasing awareness through coalition building that this is an important issue that hospitals should care about. But there are not many healthcare institutions that really really this at all levels. Of course, many have amazing providers, nurses, social workers who are very engaged in this, who really do the grassroots efforts to make this happen. But very few have that organizational top-down buy-in, which can really help. And that's what we're looking to change. And the awareness has been increasing over the last many years.
What is the role of the trauma surgeon in particular in helping with that transformation?
I think, first of all, a trauma surgeon, pediatrician, emergency doctor, internist, no matter what role we have, and even beyond physicians, nursing, social worker, everyone has a part to play. I don't think there's anything that makes, as a trauma surgeon, me or anyone else more special than anybody else to be able to lead these efforts. I think it's really about what kind of change do you want and what are you going to do to get there? And so a big part of our coalition, for example, is not trauma surgeons. We're talking pediatricians, we're talking social workers, we're talking injury prevention coordinators. Our team is vast and really encompasses all healthcare specialties.
So what is the coalition trying to do? What's the coalition asking for?
So, we launched this learning collaborative back in April 2021 to really galvanize the healthcare industry around this topic. And since that time, we now have over 400 participants from hospitals and health systems across 35 states that are part of that learning collaborative. And the collaborative is geared towards learning about gun violence prevention, but also acting. So each of those hospitals is pledging to implement strategies in the healthcare setting, which I referred to earlier, that can prevent gun injuries. And I think that's, it's really been an opportunity to learn. Like, we have a lot to learn, for example, from the work that's being done in Baltimore and Chicago. And it's a way that we can all come together to really implement best practices as the next phase, which has not happened for the last decade.
You're asking for a shift from thinking of this work preventing violence as sort of an extra on top of what normal care is like, to really making it part of the normal care. And at some point, you have to shift there from the coalition of the willing to really expecting people to do that. Have you thought about how that transition could happen? Like at some point, does this become a quality measure or even a regulatory requirement?
I think that's brilliant. I mean, that is 100% what we are working towards. As you know, very limited research has been done in the gun violence prevention space. So a lot of this is also giving us time and others to evaluate interventions. Once we get that robust evidence, absolutely, this should be a quality metric. Hospitals should be evaluated based on this quality metric. No different than really other quality metrics. Absolutely.
Well, Dr. Sathya, thank you so much for coming and talking to us about violence as a public health issue from your perspective as a trauma surgeon. I hope we can meet in person, but not in a business situation.
Thank you, Dr. Sharfstein.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.